be identified, please let us know. For example, in the chat, sending the message via chat. Yes, it's my pleasure in those difficult times to gather you all and welcome you to this call again. I will let you, what you are saying is basically the agenda for this meeting, for this gathering. Those calls are for the MyData community and for the all MyData friends around the world, or the stakeholders, to get the update on what's going on when it comes to the MyData based or human-centric initiatives around the response to COVID-19. And as you see, today we will hear from 4 of them. You will have a chance to not only to listen to what they are doing, but also ask questions and also engage in those initiatives. So we ask each of the presenter to also share with us the call for action for the community to make sure that they also their needs are answered by the community, and there is also something for you to be engaged. If you have your project, something that you would like to share with us, you can do it on the next calls, like for example next Wednesday, but you can also share this on Slack, mydata.org/Slack. We have the channel open for that, and later on I will also tell you what are the other ways of sharing the information with us. I didn't introduce myself yet. You hear my voice. That's me. I'm Carolina. I work for MyData Global, the organization organizing this this meeting, this series of the so-called Corona calls, and why we are doing this and what is MyData. My colleague Temu, who is the general manager of MyData Global, will shortly explain what MyData means, what is behind all this human-centric approach to personal data. But I will just shortly say why we decided to organize these calls. We observe, of course, for the recently a lot of traction, a lot of interest from different environments, different stakeholders in the data-based solutions to curb, to fight the virus. And as there is so much going on, it's sometimes very difficult to actually, keep, understand what is actually happening and if those efforts actually all make sense. So we would like to provide a platform when the like-minded people and organizations can actually find each other and work together without duplicating the results, to build something together. Also to provide a free access to any tools available. And as I said, actively engage and connect. As this maybe human centricity or MyData principles might be new for some of you, we are also happy to provide consultation on what it means to build a human-centric application. And we were also inspired by the article by Harari in the Financial Times, published a couple of days ago. It's called The World After Coronavirus. And in this article, Harari mentioned that actually, today there is a lot of discussion about using the data to fight the coronavirus. And of course, sometimes it feels that, is it the fight between the surveillance and the data privacy? And he claims that actually we can and we should enjoy both privacy and health. And that actually all those database solutions and all those technologies should empower citizens, that the data should enable us to make more informed personal choices and not to build the not be used to build the surveillance systems. And this very much resonates for what MyData stands for and what kind of database application and initiatives we would welcome in this war, in this fight against the virus. Help us spread the vibe. I mean, when you're now listening, watching, following what is happening, don't be shy. Share this with the world. Share it on the social media using the tags MyData, personal data, Corona data, MyData for COVID-19. And we would be very happy if you could also tag us. And with this short introduction, what are those calls about for all of you? We would also like to give you a couple of words about what is actually MyData, what is all about that. And here I would like to invite Teemu Roponen to tell us what is MyData.
Thank you, Karo. Hello, everybody. Great to have 50 people here. Amazing. Many of you familiar faces from the MyData community, not quite everyone. So I will take just 2 minutes of your time to explain MyData Global and MyData before we get to the beef, the great initiatives that we are here to hear about. Karo, can you put the next slide on, please, for me? Yes, so MyData Global, it's an international nonprofit based here in Finland, about 1.5 years old. The MyData community in itself is several years old. It was previously working under Open Knowledge Finland, a chapter of the Open Knowledge Foundation. And in MyData Global, we've got nearly 100 organizations from over 50 countries, about 500 plus individual members, and a community of a couple of thousand people who are interested in giving users control over their personal data. And we're organized globally, have these local hubs, 25 of them, and a number of thematic groups, for example, for design, for data governance, for MyData infrastructure, and such, and health. And yeah, so the beef in MyData, the vision is a fair, sustainable, prosperous digital society in which we have implemented a human-centric approach to personal data. That means that people get value from their data and they set the agenda on how it's used. And by value, I don't mean here monetary, but rather use value primarily. For organizations, the ethical use of personal data should be the most attractive option. And for this to happen, 3 key big shifts. And now is the time, of course, of shifts. Definitely the tectonic plates are moving. 3 shifts in the MyData Declaration, which was written in 2017, from formal to actionable rights, meaning that more and more we should have one-click rights to exercise data portability, access to data, right to be forgotten, and the like. More and more we should be thinking not only about data protection, but rather data empowerment. How can we have a positive data sharing future and data sharing scenarios to help us in our daily lives, be it in the times of crisis, be it in the times of understanding our health or finances and making decisions for such domains. And thirdly, moving from closed to open ecosystem, a more fair, balanced, competitive landscape where companies can also collaborate and not only compete. And if you go to the next one, thank you. Right now, members, actually 56 countries. That's nice, that's remarkable. I wonder how many countries we are from. Quite a few, I'm sure. And then just here, some of our organizational members. If you are not yet among these bunch and like what you are hearing, we of course invite you to join. You see here all kinds of companies coming from private sector, public sector, academia, non-profits, all sorts. And yes, we act locally, of course. Right now, it's difficult to act locally in terms of organizing meetups, for example, but that's why we have the virtual space, of course. But to give you some idea, we have active, vibrant network now in 25 locations, about 2/3 of those in Europe, but also, which is great, a growing number of hubs also outside of this continent. Yeah, so that's it for me as an intro, and I give it back to you, Karo, to lead us through the beef.
Yes, thank you so much, Teemu. And please, if you have some questions or comments, make the best use of the chat window for now to ask Teemu about, for example, MyData. And here is, I mean, as I said, we know that there is a lot of going on. And on this slide, we just collected a couple of examples. We will hear about the three first about the MyData Commons, FeverMap, self-help management app, MyLog14, and also one other application, Via app today. And there are also another initiatives happening, Quantified Flu or Oiretutka, that will join us for the next week call. And for your information, there are also the call for action about building the data infrastructure and ecosystem on the datastewards.net, and also the coronavirus tech handbook.com. We're also collecting our inventory of the MyData COVID response and different initiatives. So please also, if you would like to leave us a message about your initiative, your project, this is the place to go. You can enter the spreadsheet and answer the short questionnaire there. And with this, I would like to now move to Geneva, where our colleague Paul-Olivier Dehaye is joining to tell us about his initiative, the initiative that he is leading, which is called COVID-19 MyData Commons. Paul-Olivier Dehaye.
Thank you. Commons with an S, as we'll see. Mm-hmm. So next slide, please. So this, as was just presented, this COVID-19 crisis is really a threat in some way to the old way we were living, to some of the values that we cherish. The obvious one, the first one that is starting to be threatened is privacy, as we see more and more governments collecting data. But I think we will eventually see that it's also a threat to democracy, to how we run our societies, for reasons that I'll explain in a second. So next slide, please. So first, I think it's extremely important that we understand as much as we can from the science, from the best evidence we have. So this graph shows the way the virus is spreading over time from an infection moment. So you can see that most new infections occur around 5 days after an infection. That's called the serial interval. And you can see also that some of them, almost half of them, are due to post-symptomatic patients. So patients that have symptoms, but also in light blue, around half of them early on are due to patients who don't yet have symptoms. And this is the real challenge that COVID presents in terms of public health. So as a consequence, one of the solutions that has been advanced is represented by this yellow arrow. It's to try to use patients that already have symptoms to find patients that don't yet have them, but are potentially infectious. So next slide. This is how it could work. You could have a subject that actually has an infection, this little A guy, that goes around during the day, all around the place, at home, in the train, at work, and then at home again, and is potentially making a huge amount of people infectious, is potentially infecting a lot of people. And then this guy on day 2 wakes up with a fever, does a test, realizes that he's positive, and then goes back in time through all the contacts that they had over the previous 10 or something days, and notifies them that they should also take a test and maybe isolate themselves. So this is a way, when you compute the numbers to the best evidence we have, this is a way of fighting against coronavirus, against COVID, especially in the end game, especially when the prevalence of this virus is very low. But of course, it's a huge challenge to imagine logging people over the course of 10 or 14 days, all of their interactions. It's a technical challenge, but it's also a societal challenge. Next slide, please. So why is it a societal challenge? Well, clearly it's a challenge to privacy. This could really be about monitoring people in a lot of details over their whole everyday life, which a lot of people will feel is invasive, and rightly so. But beyond that, if you look at this curve, there will be a period of time towards when things are better around the epidemic, when we start to get it under control, or we have a perspective of getting it under control. We will have to make tough political choices around which measures to implement. We'll have to balance a lot of different things, like public health, like the economy and some kind of rebirth of the economy, and also even or social pleasures. I mean, can we go to France for a dinner and things like this? And this will be very, very detailed political choices, very intrusive political choices that will have to be made principally around data. So we could suffer through this in a sense. We could feel our privacy and our freedoms invaded for months on end, or we could be empowered around this. So the next slide. I think it's not just actually like Harari is saying it, it's not just about empowering individuals. I think it's really about empowering communities of people. But these communities could be very different. It could be a community of neighbors, it could be a community of coworkers, it could be a community built around a school of parents. So we need to collect data in order to be able to better understand how the disease evolves and moves and who might be infected. But we also need to preserve our values, and we need to help those communities fight against the disease. So what I suggest is that we start implementing a framework in order to build different types of commons, multiple commons. So these commons would all be aligned on some principles that we know very well, the MyData principle. So this is box 1. It would be governed by communities to be defined. There is a strong sociological angle to this claim. It will have to be legal, of course. I propose that it would be based on GDPR or principles that are very compatible with the GDPR. It would have to be ethical, based on WHO guidelines at the very least. We have to be careful around standards and APIs so as not to lock people into a system that they can't really exit as the crisis drags on. And it will also have to be, and this is very important, time-bound, limited in time to, well, the duration of the crisis. Now, it's one box, number 1, but I really think that this should be a hierarchy of communities that are trying to work together to resolve this crisis. It could be a community of neighbors, it could be your county, or it could be a canton here, or a state, or even at a global level. So that's why I have in box 2 and 3, academics, because there are local universities that can help those communities manage the disease. But there is also governments and the International Geneva and the whole framework of international organizations that help different actors work together towards resolving crisis in general. Just for information, for instance, here in Geneva, more than 50% of the nurses and the doctors are coming from France, which is very nearby. So if we are not able to work with France, things are going to be very bad for Switzerland eventually. Now, this is not just a governance framework that I'm proposing. I'm proposing that this would actually really manage data of real people. So in 4, we have the whole MyData network, the whole MyData ecosystem, with its strengths of being internationally present with hubs, but also having technologists that have thought about those issues for a long time, what it means to give individuals their data, to give them control over their data, to decide where their data goes. And they will have to decide on which commons can use their data and how. And of course, there is a whole network of hackathons that is going on all over the place right now. So this is box 5. So what I would hope is that people in MyData who want to align with this idea would start to seed it in the different hackathons they can take part in locally. There's also a lot of industry players that can have a role here. Eventually, managing COVID will also be a job for different companies. Big companies will have to defend themselves against COVID. And this will involve understanding better the risk that a worker whose wife is a doctor at a hospital represents in some sense or another, in a non-intrusive way, of course. Then one element is also the whole cryptographic and mathematical modeling aspect to help these commons make the best use of the data they have. And this is also another stream of work currently going on. And finally, there is this whole underlying technical framework of protocols, standards, and distributed IDs that the MyData community is extremely familiar with, but is absolutely necessary to power such a complex system in such a short time. Next slide, please. Oh, and on that slide, if you have the actual slides, and I'm sure they will be posted, you can see on the links on legal and ethical, those are actual links, and you can go to our current versions that are being worked on. Christian Locks, who is in this call, is working on the legal aspects, and I think Kekäläinen, who is also in this call, is working on the ethical aspects. Next slide. So I would like to acknowledge the help of Ian and Kekäläinen for starting this work, really, but it's growing very quickly. And next slide, if you want to help, definitely you should join the MyData Slack channel, the Slack workspace channel Corona Data. And we already have a hackathon here in the French-speaking part of Switzerland this Saturday, where we actually want to really test prototypes that literally I can push into my neighbor's hands to start to see whether there is adoption with these types of tools. Mm-hmm. Thank you, and I'm happy to answer questions, of course.
Thank you so much, Paul-Olivier, for presenting this, this initiative. And I would invite everyone who would like to ask the question to Paul to post your question in a chat window. And of course, you can, also please join the workspace, MyData org Slack and Corona Data to continue the discussion. I have maybe the first question to you, Paul-Olivier. Can you just explain us better or let us understand better how the framework that you presented can actually be used? How do you build an international global app, or is it something that can be used by those who are building those apps? How actually you can operationalize it? What's the use of it?
So there are many people who can build apps, and there are many people currently building apps, but it's crucial to understand the characteristics, the scientific characteristics of this disease. It's a fight simultaneously over time and over the social aspects of this disease. So by nature, you will have to collect a huge amount of very personal data in order to do good modeling. So what I'm suggesting is to build a strong governance framework for handling those aspects, legal, ethical, and so on, driven by some values that the MyData community has been defending for a long time, and then encouraging apps to be developed within that framework. And then also encouraging the actual emergence of commons handling this data and making maximal use of it. So if you look at what's happening now at the level of states, the states are collecting a huge amount of data from telecom operators to try to assess where people are being non-compliant with the rules that the states are enacting. And what I think is that you could empower the communities to do what is best for each of them so that they can progressively, very locally, but progressively wider and wider, they could get out of the lockdown that we are in because they would adopt altogether better social practices in order to get out of this.
Thank you. And can you share maybe more in detail what kind of help from the community and maybe from the people who are now on the call you would need? You said that this is now developing very quickly and it's growing. Is there something very concrete that you would like to ask people to contribute to your work?
Yes. So assuming that people here are from mostly the MyData community, you can do two things. You can help in two principal ways. The first one is connect with your local hackathons and try to communicate that this work is happening and try to connect the work you see in your local hackathon to this global effort. That's the first one. That's looking at the app side, if you want. looking at the governance side, connect with your local authorities and tell them that this work is going on and that it's worth aligning at the international level with this kind of framework. And all this can be coordinated in the Slack channel, of course.
Perfect. Thank you so much. And there were also some questions from the audience. And there is from Inzelmo. What are the prototypes that are in the development?
So this is with J-Link and Ian. So I don't know if Ian is here, but part of the idea would be that J-Link has a platform that would enable rapid prototyping. So we want to have simultaneously people in Geneva this Saturday starting to think, okay, what do we need to get out of this? And then implement very quick prototypes in J-Link, which would, the advantage of J-Link is that it governs from a technical standpoint all of the boxes that you need to fill from a data protection legal standpoint, right? So it does all the traceability of data, for instance, very well. So that's what we want to do.
Here, I put a post in the comments channel. But essentially, I think we need to start to focus on the data sets that emerge and less so on the technology, because right now there's thousands of different data sets, all with different designs and all with different technologies. That matters a lot less than the actual core data set that's produced.
And there is a good question from Johannes on the WHO app. So indeed, I saw this, but when you look at what they are developing, the governance is a bit secondary to what they are developing, it seems. It's a public health angle, which is of course extremely important, but it's not, they haven't done the rights, the legal aspects, the ethical aspects work yet, and they acknowledge that. So if it would be very worthwhile to include this part and to see how the governance framework would fit it. Yes.
Okay.
I mean, let's not build 20 times the same technology, right?
And we have 2 more minutes here to still discuss the MyData COVID-19 Commons. There was also a question if there is a database of community initiatives. Is this correct, Simon? Do I read your question correctly?
Yeah, that's the correct question. Yes.
Yeah.
If there is one.
Database of community initiatives.
Well, in a sense, all the hackathons are community initiatives, right? But there is a ton, and I don't really know. I haven't seen a listing of them. No. So Simon will be in the hackathon on Saturday. Maybe Christian wants to say a bit about the legal governance model.
Can I say there to this list of initiatives, the European Citizen Science Initiative is collecting that kind of list. They had that in Twitter and they have a homepage for that. I gave the link in the chat.
Okay, thank you so much.
Paul-Olivier, thanks for mentioning this is Christian. I posted a link for those who are willing to contribute to the legal governance model, and support will be most appreciated. I think we are coming up with a simple structure, but of course it can always be refined, and in the end we would like to come up with short checklists for those launching projects and applications or data collections. Thanks. Perfect. For any contributors.
Thank you, Christian. So just for everyone, maybe not everyone is looking at the chat, but yes, there is the message from Christian for those able and willing to contribute to the governance model legal. Please submit your contact details here, and there is a form just for all of you. Of course, there is a lot of things happening in the chat, and we will collect all those links, all those information after the call, and they will be all ready waiting for you in the Corona Data channel on Slack, and also published in the social media. But thank you so much for.
I want to insist on something I didn't say well, apparently.
Yes.
So Corona is pretty different from other viruses. Corona forces people to act, because of its characteristic, it forces to act before time. So to have access about data, to log data about the environment so that you can turn back the clock on its action. So we have to find an answer to that. The only similar virus in the past was Ebola, which was fought by simultaneously doing contact tracing, but also empowering communities to understand this and to know how to act. And this is crucial in terms of public health intervention, to really understand these aspects of community as well as individual tracing.
Thank you, Paul-Olivier, for reminding and highlighting this. And basing on that, now I would like us to move to the app, to the solutions already like being built, the applications being built. And I would like to invite joining us from Helsinki, from Finland, Otto Kekäläinen, to tell us about the work around the FeverMap app. And Otto, I will stop sharing my screen, and at the same time, please take over and share your screen and tell us what the FeverMap is about and what kind of help do you need from the community. Yeah.
All right. Hello, everybody. I'm actually on my phone, so I'm not able to share anything.
Okay. So perhaps I will open the website of the. I will open the website of the FeverMap.
I have the slides of Otto here. I will paste them on the Slack. You can maybe take it from there. Not Slack, on the chat.
Okay.
Yeah.
Let's redo this. So, this is very good. So yeah, maybe Otto, you will start, and I will get this from Temo.
All right. So thanks for the opportunity to present our project. So this is something a couple of people started working. We got this idea last week, and during the last weekend we participated in a hackathon and started implementing it, and it has gone pretty quickly, and it seems that this idea is very compelling to a lot of people. And I will tell you the general idea, and then I will tell you what are the open data point of views and why I think this is in particular interesting for you. So what we're doing is an app for people to self-report anonymously their fever. And the problem we are solving is that if you look at the newspapers today, you see that they are full of statistics of how many confirmed cases of corona there is and how many people have died of corona. But the reality is that the amount we see in the statistics is purely based on how much governments in different places are doing testing. So for example, in my own country, in Finland, the government already said 10 days ago that they're not going to test people anymore. They're only going to test cases that have been in contact with other confirmed cases. So now there's a lot of people who have fever and who are sick, but the government refuses to test them. The government doesn't even test people working in healthcare who wants to be tested because there isn't enough testing. So if you read from newspapers that the amount of infected people is very low in Finland, you need to take that with a grain of salt, that maybe it's because we're not testing. And the government is not publishing how much testing is being done, and they are not publishing. They start in the beginning of the outbreak, they published how many people were tested positive in which districts, but they scrapped that, and now they just give one number, and I don't know why. But anyway, the end result is that neither the authorities or citizens know what is the real situation going on. And our proposal is to track fever, because of the coronavirus symptoms, the fever is the most common one. And it's also something that's very simple for anybody to measure at home. And it's not, the other symptoms have some subjective component in them, but fever, your body temperature is something you can measure, and it's pretty objective what the value is. And we want to collect this information from the general public, and we want to do it with an app that is very, very simple to use. Now, you have probably been looking at all the apps coming out recently. Many of them do self-diagnosing, some of them do contact tracing, some of them are problematic from a privacy point of view. But our application tries to do just one thing, which is collect this situational awareness from the public. And we want to help the authorities by providing a solution which is basically zero cost or next to zero and can be instantly deployed. You just tell people to install this and start reporting your temperature. And this is not only for sick people. So this is for anybody who wants to participate, and you measure your temperature every day and put it here. And this will show you your own graph of your own situation. So you can see if your average temperature starts rising, and you can see that you're perhaps getting sick before you are sick. And for us, it's important to get data both from people who have fever and those who don't yet have fever, or those who don't have fever at the moment. So yes, why it's relevant? Because it's objective. Next slide, please.
Okay.
So here is a demo, but it doesn't work in this static presentation, but you can go to, and this is already a couple of days old, and we are moving very fast. So if you want to see the most recent demo, you can go to dev.fevermap.net, dev as in development, dev.fevermap.net, and see it yourself.
Okay.
Next slide, please. So we already have 600 subscribers on our mailing list, and there's lots of authorities saying that this is exactly something that they would need. And the need for this is, I think, is pretty obvious. And I think the discussion has gone over to the level that we're discussing how to implement this correctly. Please, next slide. So basically, I already actually explained the impact. So we're gonna, even if we don't get the entire population to sign up, even if we get just a certain share of the population to sign up, we can still use some models to estimate what is the prevalence of fever and symptoms in the general public. So it's not going to be super accurate, but it's going to be accurate enough for authorities, for example, when they are thinking about if they should have a lockdown or take other drastic measures, to then, when they do these measures, they can have a potential to get feedback from this application and the data it's collecting. That are these cases going up or down on a daily basis?
Okay.
So we are not doing contact tracing, and that's not what authorities in Finland are even doing anymore. They given up with testing, and they are not interested anymore in who is sick, because it's common enough, and contact tracing doesn't really help anymore. But now what we need is situational awareness of grasping how big the situation is and how it's evolving day to day. So next slide.
Okay.
Please, and you can skip this to the next slide.
I can skip that. Okay.
Yes. So we are developing this on GitLab in the open. It's open source, and we plan to publish the statistical aggregates as open data. And we have already been on your Slack channel, and some of you have already been contributing to the plans, what the data format should be like. And there have been discussions about privacy and anonymity and things that are relevant for open data. And why you should be interested in this is that unlike the other solutions, this is anonymous. So we are not asking the email address from users. We're not asking them to log in any way. We are not tracking their location, or we are not tracking their social networks. We do take their location on a zip code level when they submit their current status, but that's like once a day or so. It's not like these other contact tracing apps that are collecting the exact location information for everybody constantly. Mm-hmm. And because this is anonymous, it's easier for people to participate. And if the government would mandate that everybody must participate, then there should be less, people should be more in favor of this kind of solution. That's something that's very intrusive mm-hmm. to privacy. And also because it's anonymous, it's much easier for us to then publish the data. So everybody who are in data science and open data can then mm-hmm. improve on the analysis side.
Otto, we're a bit running out of time. Can you share with us and some concrete, okay, this is the business plan opportunities, some very concrete things where you would need help of the community? I know that there is, for example, the translating the app into different languages, yes?
So we have now 11 translations. We have all the big languages in the world. So you can check out our, you can go to our GitLab account and see the translations. If your language is missing, then you can contribute. For example, Polish is still missing.
I'm working with that.
And mm-hmm. At this moment, we have already all the design and other things pretty mature. So at this moment, we would mostly be interested in contributions for people who are front-end developers or data visualizers, or who would like to work with the analysis part and the data format part. Perfect. And everything we do is open and on GitLab, so I recommend you go and check it out yourself. So now I'm going to end my presentation, not to take too much time, and leave some room for questions.
Thank you, Otto. I will stop sharing my screen. Stop sharing my screen and go also to the questions. We have very little time now for the question, and of course there is the questions if there are some languages about already available. Is there someone who has very concrete question to Otto that you would like to ask now? I see also, and maybe Otto, you can also have a look.
Yes, I can see the questions. And
yes,
I am also on the Corona Data Slack. So if we don't have time here, I can follow up on all the questions on the Slack chat as well. And skimming through the questions. People signing up to contribute, that's great.
Yes. So perhaps, I mean, so thank you very much for the contribution, Otto, and perhaps we can then move to Taiwan to look into the app being built there. And I invite you to discuss on chat and also on Slack. So thank you so much. And now again, I will be sharing my screen with you. And now we will be moving to Taipei, and we will connect with Sherry Chung, who is working on from the MyData Taiwan hub, who works on the self-help management MyLog 14 app. Sherry, are you with us?
Yes, hi.
So maybe you can take over the screen.
Okay, so I'll share my screen.
Yes, and you have some 8 minutes.
Okay.
To tell us about your work and what would be your needs towards the community.
Okay, so here everyone can see my screen now?
Mm-hmm. Perfect.
Okay. Sorry. I think maybe I just I skipped the playing mode. Okay, so I'm here to introduce what Hop Taiwan are recently do. So we recently will build an app, and we want to help to prevent the pandemic of the coronavirus. And maybe some of you had heard my previous talking on last Friday, but here I still need to recap some information for the people who missed my last talk. So, and for now, in Taiwan, so we divide the people who may have the risk to get coronavirus. We divide the people into 3 levels. The first level is home isolation. That is person who have direct contact with the confirmed cases. And the second is home quarantine. It's the people who have the travel history to the travel warning level country. And the third is the self-health management. It's for the people who are reported case but have tested negative and meet the criteria of being released from isolation, or the people who reported and tested for COVID-19 under community-based surveillance. Also for the citizen now returning from other countries under level 1 or level 2 travel level, and notice before March 19. And for the home isolation and the home quarantine people, so they are active monitoring by the government. So they need to stay at home, cannot go to outside, and need to report twice a day about do you have fever, or if you do you have some symptoms. And so these two type of people, because they are monitoring by the government, so it's not our app's target. So our app is focused on the people who need to do the self-management and need a civic participation. And in the past few days, the cases in Taiwan has increased very significantly. So you can see the graph in the right top corner. You can see for the past few days, the case increased significantly. And for today, almost 100,000 people are under home quarantine. And you may think 100,000 sounds very little, but it's 0.5% of the total population in Taiwan. And if it's happened in US, that means it's 1.5 million people need to do the home quarantine. And not to mention the people who need to do the self-health management. So let's see the figure in right down corner. It means if we have one positive case, then 26 of his friend or his family need to be the home quarantine. Then more than 900 people that make contact with the home quarantine people need to do the self-management. So you can see in today's, because 100,000 people are under home quarantine. So not to mention there's a huge number of people who need to do the self-health management. And it's very hard for government to trace the people who do the self-management, because the self-management, you can still go outside, you can still buy food or visit your friend. It just suggests that you need to stay at home and measure your temperature and need to prevent to go to the crowded place and suggest to wear a mask. But it's not enforced, because you need to do this by yourself. So it's very hard for the government to trace this kind of people.
Sure,
So
I don't want to stress you, but I just wanted to stress the time passing. Yeah.
Okay, so in the past 3 days, we do some user interview. So to ask people who is under home quarantine or under self-health management, and ask if they are willing to use an app to record his activation, to record like his temperature or his location. And the home quarantine people, they are willing to follow the epidemic precaution and provide data required by the government. But for the self-management people, the incentive of them is very lower, because so they need to advise for the following, like what is the essential data they need to collect, and at what granularity should they collect data, with how much effort. And also for the people, they also have the question about our app, is that how will the data be used, and can he keep the data private instead of sharing to the public? And also there's a very interesting, like everyone say that they want to know who nearby are also under the home quarantine or under self-management. I think that because it's too lonely to stay at home for 14 days. So because it's difficult for people to stay home for 14 days, so it means the completion rate is very low for the self-management people. And so then there is increased the risk for the society to maybe more people will be infected by the disease. So we increase the motivation to collect the MyData. So that's why we named our app as MyLog, because we think that's a part of MyData. You can control your data and do the self-management and do the record for yourself. And also, this is also a recap of my previous talk. So it's the mock-up of our app. So the app is have the easy step to do the log. Like you need to take a photo, maybe a photo of you or a photo in your house. So that can confirm that you are at home, and maybe 3 times a day. So you can take a picture and to check that I stay at home for today and I stay for tomorrow. And the data is saved locally on the phone. The time, the longitude, latitude, and the key and data hash time have been saved. And all the data is locally on the user's phone. And after 14 days, if you finish the self-management process, then you can get a trophy that to thank you to do the self-management, and thank you to do something great to protect yourself or to also protect others. And so we started the project since last week. So today we are here today. We have some user interview, and we plan to have a workshop and hackathon on this weekend. So we will do the workshop to decide the UX and to do the first alpha version of our Android app. And the next week we would like to release our alpha version. Yes, and also we need the whole app can be public in the early of the April. So thank you.
Thank you so much. Thank you so much, Sherry. Would you like to tell us also if there is anything you need from the MyData community and where we could actually help?
Yes. I think maybe we will need more tester when our beta version is released. And also since we collect the data, follow the Taiwan's regular. So we also want to know if what is the other country like the law about how to collect data. And also we want some advice from the MyData Global to help us to check if our app can follow the MyData principle, because we definitely want our app can follow MyData principles.
Perfect. Thank you so much, Sherry, for sharing, and good luck with your work. I'm looking forward to see your progress. There was a question do you have a GitHub for MyLog 14?
Yes, we have a GitHub. We just set out the GitHub yesterday, and I will share the GitHub link on the Slack channel.
Fantastic. Thank you so much. And please again feel free to discuss with Sherry on the chat and also on the Slack channel Corona Data. And just moving quickly, I mean, towards the end of our call, which is already like full of information, inspiration, call for action. And I see also that Otto is posting to the chat different calls for action from the some previous, about the FeverMap. I wanted to shortly just introduce our colleague joining from Berlin, Sascha. Maybe you can, we don't have time now for the full pitch and presentation of your app, which is called the VIA app, but can you just shortly tell us about it? And I'm sure that you will, and if you agree, you will present your work in detail on the next call next week.
Yeah, we can do it. Obviously, we're capitalizing on the same discussion. I mean, I can share something very quickly if you want to. It's just a couple of screenshots that I took quickly to at least show you something if you want to.
Yes, if you yeah, I mean, we can give you like 3 minutes if that's okay.
Yeah, sure. Let's see.
So if you can share your screen then.
Yeah, fine. Okay, that's fine. Just like doing in the background and just show you a couple of things. So it's pretty much the same. So we are capitalizing on the fact that we have seen there's a lot of noise about how or what's the best way to track infections, to track movements in order to define the right actions, you know, like as a government, as a hospital. But we have also seen a lot of examples, and I think Paul mentioned it quite nicely. We have seen Israel, who's just installing spyware on users' phone. We have seen the way how Korea or other countries, even the US with Google, started to track the data. And we thought, hey, look, even though it's assuming it's for the good, we wanted to pull out a solution that takes the whole privacy aspect into consideration, and it's serving both. It's serving the user to know, like, if they're infected, where have they been in the past or quite recently, and also having all the information quickly on hand. But then also on the same side, you know, for the governments or for the hospitals, having access to the information to make the right decisions and to have the right conclusions based on it. So, for example, here what you see on the screen is that, like, it's very easy for a user to track symptoms, and they can log in and onboard completely anonymously, just like tracking on the symptoms, whether that's like dry cough or maybe short breath or maybe loss of taste, and then they can mix it with the location they have recently been. So here we are going back to about a month in time here. So, and all the information is stored on the phone anyways. And then basically we allow them, hey, look, you have the symptoms. You have also been in areas with high infections rate by the time you have been there. You better going with a doctor, or your risk is like high or your risk is medium. So we can make some judgments here. And those information, taking into consideration there's many users, those information can be provided in an aggregated anonymous view, for example, to a hospital. So the hospital can have the right conclusions, and they can say, hey, look, I see that there is a lot of, or we see there's a rising numbers of symptoms, there's a rising numbers of let's say, infections, so I can take appropriate actions for my hospital, for my government. I can push out notification into the app, you know, that are valid for a particular region, saying, hey, we have seen rising symptoms, maybe diarrhea or maybe loss of taste. Just be super careful for those symptoms. If you have them, put yourself into self-quarantine. And that is what we're doing in a nutshell, right? If anyone wants to know more about VIA, wants to know more about the Global Citizen Foundation, just reach out to me on LinkedIn. Like to sum it up, what would I like to take away here is, Paul, you mentioned a framework that you are currently working on. I would be super interested to learn more where you are and how can we apply it now, today. We are also talking with hospitals. So my father-in-law, he runs the biggest doctors or medical associations here in Germany, in Hessen. So he's helping us to giving us the right contacts into doctors, into hospitals, et cetera, to build a solution that truly matters, you know, for everyone. Mm-hmm. Like that's talking in a nutshell what we're doing. And again, guys, I'm happy to share more. Like that is the screens, how does the solution looks like, and how you could track your status and the symptoms and anything. But given the time, yeah, it would be.
Well, I must say that when you started talking, people requested more time and giving you the right to explain and connect. So
Okay.
so if that's okay with you, then yeah, let's not rush and still give this your solution also a chance to be discussed and find a common, I mean, the synergies. And also maybe, is there anything concrete that you need from, I mean, you mentioned Paul-Olivier Dehaye. Is there anything else you would like from the community? And maybe also joining with my question, do you see this as the like European or global solution, or do you see it as you know?
Well, I truly believe it's a global
Mm-hmm.
it's a global crisis. So it should be seen as a global solution. However, I do not like claim that we build a global solution here. But I think what we want to do is like we want to build a solution, a safe place that is taking away the uncertainties that many people have, but also providing those so important and valuable information to hospitals, to governance, so they can take the right actions. You know, because that is what we learned when we were talking with the crisis management in Germany. So the biggest problem for them is to predict where the infections appear, where are the trends is, and how can they react in terms of like how many resources we need, how many beds do we need, how many nurses we have to call, do we need to call reserves, you know? And that's the kind of very super valuable information we are getting here. And also then as a user, you can do self-tests, but you can also upload a test from your doctors that then are validated, that they are real, you know. And obviously some of it is like on a solidarity principle. Some of it is going to be on truly, let's say, like validated data. And that's what we are aiming. So we are still in development mode, obviously, as we just started last week with it. So we have our first version ready mid next week. From a language perspective, we go with German, English, Turkish, and Arabian to serve best the German market. And there's a big Turkish community and Arabic community. That's why we selected for those. And then we are going into additional languages. So actually, a friend of mine was presenting to the Polish Parliament today. Very, very good chance that we have Polish as one of the next language. And then obviously Spanish, France, on the priorities, but it takes us about a day and a half to add a new language here.
Sure.
And that's where we obviously could need help, but again, making sure the thing is like bulletproof on good, let's say, on good faith. I'm truly interested in the framework that Paul was talking about prior.
Thank you. And there is a couple of questions in the chat, and one is about what are VIA's current guiding principles or framework for privacy. And it's also,
So we are applying the SSI principles. We adopting most of the MyData principle anyways. And again, like we make sure that everything being used within the app is, I can open up the video here, then you have a face. It's like out of the fabric, still with my hat on.
Hi.
Yeah, hi guys. So we, so we're implying obviously the SSI principles in that respect. We're making sure that all the data is mostly anonymous, even the onboarding is anonymous. You don't need to share data, you can share data. And for the good and for the help of anyone to get through the crisis fast and to finally flatten the curve. Yeah, that is for sure. Yeah.
Thank you. And there are also some practical questions. Where can I find your app? And if you can share the presentation with, at least with Otto, I believe, with all of us.
Yeah, sure. Yeah, certainly, guys, like reach out to me. We're still working on the landing page. So we think we got to have the landing page ready over the next days. So we're heavily working on the communication, and everything will be mostly transparent. So we do not have a good page yet. The development of the app will be React. So that means it's available for both devices, for the Androids and for the Apples of this world. So we do not develop specific applications in that respect. Yeah. But anything else, ping me on LinkedIn. Yeah.
Perfect. Thank you so much. And maybe then my joint question to Otto and Sascha and maybe I mean also Sherry, like how do you think, like I mean from the user's perspective it starts to of course be a bit like, oh my God, so many apps, and of course I want to report my symptoms. I want to make sure that I know where the people who are, you know, am I in the risk area and so on. But with all this amount of apps, what's your, and this is the general question to all of you, what's your view on this? Like, how can we actually work together instead of like competing with each other?
Good question. I don't have a good answer for that, to be honest. Yeah, I know there's a lot of noise, there's a lot of information. I think what's truly important here is, first of all, the app must be free. There must be no business model or any other interest behind it. Secondly, this app needs continuity. That means it has to have somehow a structure that's been maintained. I think it's not the first and it's not the last pandemic that we are seeing, right? Like over the last 10 years, there were a couple. And I think it's important that there is continuity, that there is like a strong will, and then obviously there's a buy-in by a government, you know, like to support this one on the ongoing developments. And I think this one, whatever the solution looks like, can be used as an early warning system. And I think people should be given the freedom that they can choose the app wherever they want to. However, like the information must be somehow pooled and made available. So that everyone, each country, each region or whatever can take the appropriate actions. I think that's so important. That's what I have seen as the biggest challenge for anyone to define or to make informed and good decisions very fast, very quickly these days. Yeah, that's just my 2 cents. I'm happy to work with you guys.
Sherry, do you want to comment?
Yeah.
Actually, I didn't prepare for that question either.
Well, I don't know how is it in Taiwan, but I'm sure that of course there is also plenty of different apps appearing right now, isn't it?
Actually, we decided when we decided to do some app to help the situations, we do some survey and we found there's a lot of API and apps for the mask, because Taiwan do a very great job to the mask purchasing system. So there's a lot of app for the mask map. So how can you buy the mask and what is the stock of the stock number of the mask? And we found that there's there's lacking app that target to a person, like the person who are under quarantine or person who might have the risk to get the disease. So what can he do? What can he do to prevent to protect himself, or what is the suggestion for if I came from the foreign country, although the country is in the safe list, but you know the situation changes every day. So what is the best process I can choose? Like if there's some app for me that suggests I should stay at home or suggest I should do something, I think that app is it's lacking of this kind of way. So that is why we decided to do the app for targeting for the self-management people, because these people, they might be healthy and they might also infected by the virus. We have no idea. So so that's what we want to do, and that is also we found there's like this kind of app is very few. Yeah.
Thank you. Yeah, indeed, your app is like targeted to the different audience and different needs. And just maybe last comment from Otto.
Yeah, so I agree with that the app that we settle on should be open source and transparent, and it should be government backed. And obviously, the purpose of these apps is to help the governments like manage the situation properly. So eventually, if we have too many apps now, then there's probably going to be lots of innovation going on, and then we're going to settle on what are the best solutions, and hopefully governments will choose to back some of the solutions and then ensure that they are widely used so that they actually reap the benefits that they're supposed to do. And also, I think one thing to consider is the APIs and the data. So for example, our app is built so that in theory, our front end could be sending the data also to some other places, or somebody else could adopt the data model we have and then be submitting the data to our server to aggregate the information. So also on a technical level, there's possibility to collaborate And at least from our point of view, since this is open source, anybody's free to look at what we've done and either copy it or collaborate with us. And we also have the model that if you want, you can easily take, you don't have to use the app we're doing, but you can do a localized version of that that maybe has some additional features that serve the local government. Mm-hmm. So this is how we're approaching this multitude of options, by giving even more options on how to do it. But out of this, I think the optimal solution will surface, and it's probably going to surface pretty soon.
Mm-hmm. Thank you so much. And of course, at this very moment, we are at least here in Finland and here in Europe, we're really lacking those solutions. So I wish you all the best, and I hope that with all the help and with all the mobilization, like also hopefully thanks to this call, you received the help needed. And well, of course, as I mentioned in the chat, we can talk as long as possible, but of course, I'm sure that you all have different tasks, different things that you have to also take care at home and at work. So I would go towards closing this call. But this is not the end. Well, we all, I think, would hope that the whole problem was solved, and we could just live come back to the normal life. But this will take a couple of weeks, so we will continue with those calls. We will look in the progress of those initiatives that have been already presented, and we will also look into the new initiatives to showcase them, to bring them to all of you, to also bring them to the attention to the decision makers and media, and well, later when they're operational, of course, when they are already on, to the attention of the users, because we know that, of course, we need the users and their trust to actually share the data with us. But if you have if you are working on an initiative that you would like to share with us, and with us meaning MyData Global, and us meaning the people on the call, but also us with each other, please go to the spreadsheet. You see the short URL, which is not so short, mydataglobal.org, MyData COVID-19 inventory, and please fill in the information about your initiative, what kind of help you need, what is actually something that you are bringing, and something that you would like us to help you with. And of course, again, Slack, for those who don't know Slack, there might be some people who've never worked with Slack. That's the communication platform or working room, working space, where you can find the channel called Corona Data and ask your question and also contribute there. And again, please follow our social media and also spread the joy on the social media. Joy and information, that's what we can spread today with no limits and no problems. And also, if you would like to learn more about MyData, you can find everything on mydata.org. You can also join us as the member, as Teemu said. We have now the members from more than 50 countries. And well, there is no limits. So join us as the individual member and join us as the organizational member. I see that someone got the error on the spreadsheet. I will look into that, Valentina. Thank you for letting me know. And with this, I would like to invite you, as I said, well, the problem will stay with us with at least some weeks, some months. So I would like to invite you for the next call next Wednesday, the same time, the same Zoom link. So if you found your way here, yeah, please save the link and use it next week. Yes, I will. Okay, there was also the question about sharing the link to the spreadsheet in the chat. I will do it right away. I will stop sharing my screen, and I would like to wish you all the best and all the successes with your initiatives, and also lots of